Every day, our kidneys work to filter waste and excess fluids from our blood. But what happens when they stop working? That is where hemodialysis comes in. It is a life-saving treatment that takes over when the kidneys can no longer do their job. By circulating a patient's blood through a machine, hemodialysis removes toxins, balances electrolytes, and keeps the body functioning. Most people think of dialysis as something done in a hospital or clinic. That is called in-center hemodialysis, where patients go to a facility several times a week for treatment under medical supervision. But there's another option called home hemodialysis. With the right training, patients can perform dialysis at home on their own schedule. So why choose home hemodialysis? It gives people more flexibility because they can do treatments when it's most convenient for them. It can also lead to better health because more frequent dialysis helps control blood pressure and reduces complications. And most importantly, it gives patients more independence. They have greater control over their care and daily lives. With advances in technology and support from healthcare teams, home hemodialysis is becoming a game changer for people living with kidney disease. In this video, we'll explore how it works and why it could be the future of dialysis. Let's take a closer look at the science behind home hemodialysis. During this process, blood is drawn from your body through a needle and pumped by a roller pump into a special filter called a dialyser. Inside the dialyser, a semi-permeable membrane allows waste products like urea, creatine, and excess electrolytes to pass into the dialysis fluid, called the dialycyte, while keeping essential components like red blood cells and proteins in the bloodstream. The used dialysis fluid, now containing the filtered waste, is removed while clean blood is returned to the body. This process helps maintain a healthy balance of fluids, electrolytes, and waste, mimicking the function of healthy kidneys. Home dialysis uses specialized medical equipment to perform dialysis treatment outside a clinical setting. Let's go over some key components. The hemodialysis machine pumps blood, controls flow, and monitors treatment. That acts as an artificial kidney to remove waste and excess fluid. Tubing and needles help access the bloodstream, while a water purification system ensures the dialysis fluid is clean and safe. A study published in Kidney International Reports found that patients who do extended home hemodialysis have a 40% lower risk of death compared to those receiving standard in-center dialysis. They also had a 30% fewer hospital visits and a lower chance of heart problems. One key reason for these benefits is the difference in treatment schedules. In-center dialysis is typically done 3 times a week for about 4 hours per session, which can cause fluid and toxin buildup between treatments, sometimes leading to side effects like fatigue and nausea. In contrast, home dialysis is often done more frequently, around 4 to 6 times per week, with shorter sessions lasting 2.5 to 3.5 hours. Some patients even choose overnight treatments, which allow for a gentler, longer process that closely mimics natural kidney function. Home hemodialysis offers greater flexibility and improved health outcomes, including better blood pressure control and reduced hospitalizations. However, only about 2% of dialysis patients in the US and Canada use home hemodialysis due to financial and psychological barriers. Addressing these challenges requires financial aid, enhancing training, and increased healthcare support. Home hemodialysis comes with significant costs, including home modifications, water treatment systems, and increased utility expenses, with insurance covering only essential medical supplies. Space constraints are also another issue, as home hemodialysis requires designated areas for equipment and storage. Adjusting training typically lasts 4 to 8 weeks, requiring time, commitment, and support from caregivers. Nephrologists, dialysis nurses, and educators play a critical role in training patients and caregivers, offering ongoing supervision and ensuring emergency preparedness. Studies show that patients who receive comprehensive training and provider support are twice as likely to succeed in home hemodialysis. A multidisciplinary team approach improves patient confidence and long-term adherence. Many patients express fears about self-cannulation, equipment malfunctions, and managing complications at home. Structured training programs, peer mentorship, and access to 24/7 clinical support help alleviate anxiety. Research indicates that patients with higher perceived self-sufficiency are 60% more likely to continue home hemodialysis long-term. Educating patients on the benefits of home hemodialysis, such as improved quality of life and greater independence, also enhances adoption rates. Organizations like the National Kidney Foundation and the Home Dialysis Center provide financial assistance, peer support networks, and educational materials. Virtual support groups and telehealth services offer additional guidance. Expanding access to these resources can improve patient confidence and encourage wider home hemodialysis adoption. The chosen expert in this field is Kimberly Capoccitti. She was a registered nurse and was just the manager for home hemodialysis at Humber River Health in North York, and now has just moved to in-clinic hemodialysis. When I interviewed with her, she explained that the best reflection for home hemodialysis is the patient's feedback from it. So I'll be sharing some patient feedback on home hemodialysis. So the first question was asking how would they rate their daily lives with home hemodialysis. The average was around a 57 out of 100, with 0 being the worst and then 100 being the best. The second question that was asked was, in what ways has the assisted home hemodialysis program with a dialysis liaison help you? And a dialysis liaison is a personal support worker. So lots of responses were revolved around more time for themselves and not having to constantly go to the clinic or hospital, and also having more freedom, time management, and comfortability. And the last question that was asked is, do you have any suggestions for improving the home hemodialysis program? And a lot of comments were overall positive in that it worked perfectly with their daily lives. Thank you for watching, and hope you learned a little something about home hemodialysis.